Hi, everyone. Good morning. Happy Tuesday. Welcome to another session with Dr. Ben. I'm Dr. Ben Benham. I'm the founder of Happy Hit. Again, we had a great session last week, and we're going to start it again today. I'm going to basically just start off by answering the questions. I had sexual status from oral finasteride. Should I expect the same from topical? So one of the main reasons why we actually made Happy Ed was because we had a lot of patients in our own personal office that had sexual side effects on oral finasteride. So we came out with a topical finasteride formula because according to clinical studies, the topical had a lower risk of sexual side effects. And in our clinical practice, we also see the same thing, that although some patients did have side effects on oral finasteride, they did not have side effects on the topical. Now, that doesn't mean that's the same for everyone. We also certainly had patients who took the oral and side effects, and also that the topical had side effects. But I think for majority of patients, if you titrate the topical up slowly, you're going to reduce your risk of sexual side effects. And my recommendation is that if you have side effects on the oral finasteride, you should go up slowly on the topical, which means instead of doing the Happy Ed every day to start out with, do it just 3 times a week, only once a day. Then, like every week, add one additional night to go from 3 times a week to 4 times a week, then 5 times a week, then whatever, 7 times a week, doing it once a day, and then you're gonna go to twice a day. Again, twice a day, once a week, twice a day, twice a week, and also realize that the droppers are calibrated. So we typically recommend doing 2 halves twice a day, but you could start off with just doing 1/2 once a day. So there's a lot of way that you could titrate yourself up slowly on the product. Please remember, it is not a race. You don't have to basically jump right into this right away. The slower you go up, the better you're gonna, honestly, better results you're gonna have. Hi, I've had a bad cold. Should I still be doing my topical solution? It really shouldn't affect it. I mean, honestly, if you have a really bad cold, maybe you just want to take it easy for a couple of days, relax, drink some soup, and worry about the hair after you get over the cold. But if you really want, you could still do that both at the same time. Can I use 2% ketoconazole on my scalp for itchiness? So the ketoconazole 2% shampoo is an anti-dandruff medication. Um, it could help a little with the itching from the dandruff. At the same time, you have to realize that the 2% is also very irritating, and could in fact cause some irritation and some itchiness as well. So, but yes, you could use the 2%. If it doesn't help with the itchiness, we actually have a special dandruff line where you get the 2% shampoo and also steroid, which will really calm down the itchiness. You could reach out to Happy Head, Help and Happy Head, and it could and tell them about the dandruff solution, and we'll basically get you started on it. You should also probably be on the website as well. Thank you so much for that question. I have little scabs formed on my scalp. Should I continue taking it? I'm taking 1 time per day. So you're doing it once a day. You have some scabs. So the scabs could come. So the topical minoxidil happy could cause some irritation and scabbing. So that's what's going on. So you could. So what you can do is take a week off, and then restart again. And maybe instead of doing 2 halves once a day, you could do one half once a day. Also, you could reach out to us and we could basically switch out the formula to what's called the water-based formula, the Aquas formula. The Aquas formula has 80% less alcohol in it. It's still the same formula, but just basically less alcohol, so it's less irritating. So send us an email at help@happyhead, and we'll be more than happy to search it out for you. Hello. Is there a minimum age to use this? Well, this is a prescription grade product, so you have to be 18 years of age in order to submit your consultation and use the product. At what level of hair loss can someone start on this treatment? So, it really depends. I mean, we have a lot of patients. I was talking to a patient this morning, and he had a really good set of hair, but it was the fear of losing the hair. So he wanted to kind of be proactive about it because his dad was bald. So you could really start this at any level. I mean, you just have to realize that if you're in what's called Norwood class 6 or 7, where you're really bald and there's no hair, it's not going to help you. But we have a lot of patients that do it proactively. We have a lot of patients in the early 20s that are just starting to thin out, so they start doing it right away. Some patients they see the widow's peak basically moving back further, so they want to be proactive about it. So really, at pretty much any stage you can use it, except like if you're bald, it's not gonna help you. I am 21 days post transplant. How soon can I use your prescription? It's about 6 weeks. I will wait 6 weeks before using the product, and it will really help basically with the transplant areas as well. Hi, Dr. Ben. Thanks a lot for these very helpful AMAs. Thank you for joining me. It's honestly, we have a great time doing it. I have a few questions. I've cut my hair very short, like a buzz cut, as a coping mechanism and to avoid having to brush. I've noticed about 10 to 15 strands of hair on my pillow on some mornings, not every day. Is this excessive? No, it is not. 10 to 15 is actually normal. I mean, look, guys, I could literally just comb through my hair. I mean, yeah, you get one or two. I mean, that's normal. You could lose up to 100 hairs a day. Is it normal to see a few strands around the house throughout the day? Yes. Can build up from topical minoxidil exacerbate the shedding? Good question. So if the minoxidil is causing a lot of irritation, that means redness, bumpiness, flakiness, just a lot of itching, then that could irritate your scalp more and cause more shedding. So this is why if the product is irritating you, there are things we could do, and the things we could do is, well, first of all, one, you could wash the product out after 1 to 2 hours, and you're not going to sacrifice efficacy. Number two, you could let us know, and we could switch out the formula to what's called the aqueous water-based formula. Basically, where it's 80% less alcohol in it. It's basically a lot of it just botanical ingredients, which is more soothing and less alcohol, so it's irritating. We could also reduce the minoxidil and take out the retinoic acid. So, and all of those basically could help a lot. So, again, reach out to us, help at Happy, and we'll get a new product out for you free of charge. We're here to help out.
With the water base, it's only available in the 8% minoxidil. How would people go about that if they need like a lower?
So good question. So my experience has been that the water-based formula solves 96% of all the irritation issues. 96 to 97%. I mean, it really does. So if you are having irritation from the product, we could switch out to a water-based formula, and that's in majority of cases going to solve the problem. If that doesn't, what I recommend, basically when you apply the product, just wash it out in 1 or 2 hours. We also used to have this scalp serum. We don't have it anymore, Evelyn? No. So, but we're working on one, right? Yeah. Yes, we're working on a scalp serum as well. Basically, just more soothing. Will it work on the front of my hairline? Yes, it will work. So here's the thing: if you have a widow's peak and you have no hair here, there's nothing that's gonna work except hair transplant. But if you're missing more hair in the widow's peak areas, then yes, you could apply Happy at there, and it will help you. Is it normal for it to get crusty? No irritation, just area gets crusty and hard to brush. Yes, that's normal, unfortunately. I think that could also be from the aloe, so you could request to take the aloe out and see if that helps you. Take the aloe out and probably we take the retin-A out as well. So I'm experiencing a painful scalp, like pulling of my hair. I don't have any scabs, redness, or dryness. My scalp appears healthy. I'm also seeing great results in less than a month. Should my product be adjusted, and why is there not a place on the homepage account to message my doctor about the progress or concerns? Okay, great question. About the website, we're still working on it. Sorry about that. So very interesting. So painful scalp, but there's no scabs. Um, so my question would be, did this start after using Happy Head? That's question number one. Uh, Question number two, typically tenderness on the scalp is a sign of stress and other stuff going on. So maybe there's some other stuff going on. But if this did start after using the Happy Head, reach out to us, and we should probably, well, maybe we could start searching out to a water-based formula and see if that helps. If not, if that doesn't help, we could probably start lowering the minoxidil concentration or even taking it out and see if that helps. Usually, if you have painful scabs, it's usually associated with redness, irritation, scabbing. But in your case, it's not. So that's a little bit strange. So I really do not know the answer to that. If nothing helps, just basically reach out and make an appointment with me on one of the Tuesday mornings, and I'll be more than happy to get on a call with you personally and talk this out one on one. Again, guys, our email is help at happyhead, and we are here to help you. I remember Happyhead is a customizable formula. So I'm considering an order for myself as well. The other one's for my son. I have very long, fine, healthy hair, but very white scalp is creeping through, and my part is widening. I already used minoxidil and started taking oral dutasteride for less than 1 month. So okay, so you already okay. So wait, I think this was the same patient that was saying that he has painful scalp. So I think it says that you're already doing the minoxidil. So it's possible that the topical minoxidil using is just causing some irritation on the scalp that you're just not seeing it. I think that's what's going on. I love oral dutasteride. So my recommendation would be to go on the topical minoxidil finasteride, our standard formula. And by doing the oral dutasteride, basically, it's going to help you well as long as you're not having any sexual side effects. Again, if you're having tenderness on the scalp by using the over-counter minoxidil, it might be worthwhile to do a product without minoxidil or just do the water-based formula. The scalp sensitivity could come from one, the minoxidil, to the alcohol within the solution. So again, you could always schedule a meeting with me, and I'll be more than happy. I'll be more than happy basically to talk this out. Could genetic hair thinning be reversed with these products? Does this mean that if our mothers and grandparents had this, they could have saved their hair as well? So yes, look, majority of hair loss, I mean, male pattern hair loss is genetic. So, and we obviously have seen great results. So yes, so this could reverse genetic hair loss, what's called genetic miniaturization or androgenetic alopecia. Yes, it is possible that our parents or grandparents had these products and would have saved their hair as well. And the shampoo that I recommend is the Happiest shampoo. The reason why I like that is because it's a collagen biotin shampoo, and honestly, it really helps. In conjunction with the Happiest product, it helps quite a bit. I've been on topical side 1 month, 1 month and a half, but I've scabs in the back of my head and my scalp. Could this allow the solution to enter systemically? But it recently came down with a cold, stuffed upper nose, runny nose, headaches. Do they have any connections? No, there's really no connection between that. I mean, unfortunately, you probably just got a cold. If you did get some scabs, again, it's just irritating your scalp a little bit. So we could switch the product out. Switch the product out to the water-based formula. Please let us know. Again, email us at help@happyhair.com.
Would you start by removing retinoic acid or just go straight to water?
You could also basically we could also start by remove the retinoic acid and also reducing the minoxidil concentration. So we could do that as well. I would probably go minoxidil from 8% to 6%, and also remove the retinoic acid as well. Please email us at help@happyhead and say that I'm having some irritation, and the customer service team will guide you in the right direction. I'm on your topical finasteride, and I'm planning to switch into your oral super capsule finasteride with minoxidil and vitamin D. Will shedding a clarify switch? Typically not. Also, will your oral capsule be as effective as the oral treatment? Well, so I don't understand that question. So typically, so the regular oral medications include oral finasteride and oral minoxidil. Our super capsule basically has the finasteride, minoxidil, vitamin D all combined together. So I think it should be more effective actually than taking those. Is taking an oral finasteride because this has more medications. Number two, what I would actually do, you're already on the topical minoxidil finasteride. Instead of switching, I will actually add the oral super capsule. Reason is because if you do the topical and oral together, is called sandwiching, and you will see better results. I mean, just from our patients we see in our office, you will see better results. Is the water-based formula as effective as alcohol-based? Yes, absolutely. It has all of the same ingredients in it. Finasteride, minoxidil, retinoic acid is exactly the same. The only difference is that, see, for the minoxidil to dissolve in the solution, you need alcohol. So traditionally we've had 50% propylene glycol and 50% ethanol, and what we've done is actually we've removed the propylene glycol completely and reduced the ethanol, I think, to about 20%. So 80% of the solution is this botanical ingredient. It is actually more expensive for us to make it because we license out that vehicle base from a third party company. So, but yes, it is as effective. It's probably not more because people are gonna have less irritation, so they're gonna use it more. I'm currently taking. I love all these questions, by the way. This is great. After I'm done, usually with these sessions, my brain like still like moving and like at 100 miles per hour. I'm currently taking a testosterone replacement therapy. Is the finasteride an appropriate hair loss prevention while on TRT? Yes. We have a lot of patients that are on TRT, and basically they go on Happy proactively in order to prevent the hair loss that could happen from the TRT. I'm currently taking the kitchen sink formula and getting awesome results. Woohoo! We did like a cheerleader team here, yeah. Yeah. However, it does make my hair sticky and greasy and could cause some of flakiness. What can I do? So the stickiness and greasiness is coming from the aloe vera, but I don't. So usually we could take out the aloe vera, but I don't think we could take out the aloe vera from the kitchen sink. Evelyn, can we?
The aloe vera from the kitchen sink. Good question.
I don't know. We have to ask. Evelyn is going to look into it. Um, please email help at Happy Ed and
If you don't have it available yet, it would be a special request, so it would take a little bit longer, but potentially yes.
yeah, potential. So it's not on our standard formula, but we could potentially make it. Also, I'm a good candidate for super capsule. If so, do you recommend the oral dutasteride minoxidil or the one with finasteride? I would actually do. See, you're already doing the topical dutasteride with. I said with you're already in the kitchen sink, so you already have the topical dutasteride with finasteride. So I would do the one with the dutasteride super capsule. I think that's gonna work for you better.
Uh,
But dutasteride inhibits two enzymes as opposed to one. So in clinical studies, oral dutasteride did better than oral finasteride. However, this is the but portion. There were some patients that did not respond to dutasteride. So in general, dutasteride worked better, but some patients just did not respond. So try with the oral dutasteride. We could always switch it out to finasteride. As a woman, can I start with finasteride 0.3 and minoxidil 8 instead of the finasteride 0.1 and minoxidil 6? Yes, you can. A couple caveats: you have to be above age 50. Number two, the only issue with minoxidil 8% is that it could cause you peach fuzz. Peach fuzz means you're gonna get some hair on your face, which most females do not appreciate. That's why the female formula has a minoxidil 6%. Um, you could probably do the finasteride 0.3 with minoxidil 6%. If you really want the 8%, which some females do, just watch out for that peach fuzz hair. Again, some people may not mind it, but I just have to tell you. Also, if you're in darker skin, um, like Middle Eastern or Hispanic or African American, you are more likely to see that peach fuzz than someone who's white skin, blonde hair. If I started with oral finasteride, added a topical, would it benefit to switch to oral finasteride instead? Um, so patients on oral finasteride and topical finasteride do much better than each one of them alone by themselves. If you're already on the topical finasteride, then yeah, you could switch to oral finasteride. Yeah, no problem. What's your thought on RPC? These are great questions. Okay, so um, you know, so basically, what RPC basically is medicinal Procapil and is a Capexel. So the key is, see, at Happy Head, the whole premise of Happy Head was that the products were designed based on clinical studies. I've yet to read, and not just one study, and there are many studies out there. And there was another really good one published in the Journal of American Academy of Dermatology last year, basically about topical finasteride and all that stuff. The problem with like a lot of these ingredients is that the RPC is that there's really not much clinical study behind them. So if you could show me, and I'm happy we're founded by doctors and we're clinical. We want to give you the best prescription grade ingredients. So if there are clinical studies behind it, we'll be more than happy to incorporate a happy head. I mean, unfortunately, a lot of these products do not have really good clinical studies behind them. What happens if I switch oral spironolactone to topical spironolactone? Um what happens? Great question. So, I mean, if you're already on oral spironolactone, my recommendation is that instead of switching over, I would add it on top of it. You're probably going to see better results. If you're already taking blood pressure medication, is there a risk, or can you still take the happy head with topical minoxidil and finasteride? Typically, the topical minoxidil does not change the blood pressure that much. I mean, there's always a risk, but that's a little unusual. So most patients should do pretty well. But you could also buy blood pressure cuff and measure your blood pressure at home. Should I add the super capsule to topical or switch instead? No, add the super capsule. Add it on top. So a trend in our clinical practice has been patients are on the topical happy head finasteride with minoxidil, and they're coming in and they're adding oral minoxidil and oral finasteride. Those patients obviously see much better results. Can men take Spiro and is there benefit? This is a very good question. So in the States, in United States, men, we do not prescribe spironolactone to men for hair loss. We just don't. I mean, that's just how it's practiced. That's just how it is. So we mainly do it for females.
But if somebody were to request it and say they were already taking like a topical, is there any like
We don't give it out. I don't think our doctors would prescribe for. Spironolactone is a blood pressure medication. I mean, it's intended for men and females, but we typically just don't do it. Now, also in the United States, they do. And there are studies out of Egypt, I believe, where they did topical spironolactone in males and females. How do supplements help? Supplements, so basically, your hair needs proteins and amino acids to grow out. So if you're lacking vitamin D, vitamin B6, B12, then you're lacking the essential ingredients for your body to make hair. Um, so that's why supplements are very important.
so we just started sharing our holiday pack and it's on the comments on the side what it includes. Can you explain how that would be beneficial?
Yeah, so I'll explain. So typically there's something called the four pillars of hair loss, and what that means is that let's say if you're taking oral finasteride, oral minoxidil, and using the kitchen sink, but you're not seeing growth. The problem it's not the medication. It could be the fact that um, is the fact that you're probably lacking certain protein amino acids. So, for example, I have patients that come in and their iron level, like ferritin level, is like 7, and the D level is like 9. I mean, those are really, really, really low numbers. And yeah, you're not going to grow any hair if you don't have the essential amino acids. Here's another example. Let's say if you want to build a house and you have all the construction workers there about to build a house, but there are no bricks. Can you build a house? No. It's the same concept. You could take all these medications for hair growth, but if you don't have the essential amino acids for your hair loss, like the amino acids and proteins and vitamin D and iron, you're not going to grow the hair. So this is why it's so important, with respect to when you do these products, you have to supplement with like, vitamins, and that's why we have the Happy multivitamins and also the shampoo helps, which is the biotin collagen shampoo. Remember, it's a synergistic effect. How many results in 2 months should I increase the dose or wait? I will wait another 2 months. It's just early. Really, hair growth takes about 4 to 6 months for it to come out.
And then the next question would be what type of like antidepressants would have like weird interactions that people should be worried
Yeah.
about?
So again, with the topical, a lot of those antidepressants really don't have much interactions. Honestly, even with the orals, really, there's not much interaction. Um, so for the most part, safe. But when you do submit your consultation, please list all the medication you're currently in, so our doctors can review it. And also, you can always go back to your own doctor and make sure that everything is good. Is there a particular meat source for protein to grow hair, but also avoiding weight gain? So meat source. So look, we love chicken. I recommend pasture raised chicken. I think that's great. Again, if you could do the whey protein concentrate, that will help you as well. Remember, whey protein isolate is bad, so we would typically recommend the concentrate. Um, Yeah. As a vegan, is it true that there's a high risk of hair loss? Absolutely. Vegetarians and vegans, they have a higher risk um, just because of the fact that you're not, a lot of those patients, unfortunately, are missing certain proteins and amino acids. So supplementing with one, whey protein concentrate, two, adding like a happy head supplement to it, all those will help you. So my son is using your product, age 21. He has scalp pain by seeing hair growth in just a few weeks. Well, I'm glad that seeing his scalp growth is he's seeing hair growth, and he's having scalp pain. So I think what's going on is that the product is just causing some irritation. I will reach back out to us and one again, you could take the reduce the minoxidil from 8% to 6%, take out the retinoic acid and see how it does. If that doesn't help, I will switch out to the water-based formula. I also recommend washing out the product after 1 hour or 2 hours. If I use the super capsule as opposed to topical treatment, I would say the question is, can you use the super capsule instead of topical treatment? Yes, you could. Again, if you're doing the topical, it's better to actually add something on as opposed to remove it. So if you're using the topical happy and add the super capsule to it, you're gonna see better results as long as you're not having any side effects. I started minoxidil and PRP around the same time, which is about 8 months ago, and haven't seen any results. Should I stop the topical minoxidil and switch to oral? So number one, is this topical minoxidil or the over-the-counter minoxidil? That's the question. Number two, yeah, you could probably switch to oral minoxidil. I will give you a secret, and this is something that most people don't know. But if you actually do PRP and do oral minoxidil, your results will be much, much significantly better. It is not necessarily true with oral finasteride. It's really just with oral minoxidil. So if you're not seeing results with topical minoxidil, you could add, not just switch, add oral minoxidil to regimen.
And then we have an update. There is no redness from Donna from her son. There's no redness or signs of irritation. So the scalp pain, I guess it's a little confusing.
Yeah, the scalp pain is confusing. Can you please just make an appointment with me? I think Emily shared my calendar schedule, and if you can't get on my schedule, just send like information, and maybe we could have a call one of these mornings. Um, yeah, just make an appointment with me, and we'll get on a call together personally. Well, guys, I wish you guys a happy holiday. Thank you so much for joining us today a little bit earlier because I have to get on another a podcast in about 3 minutes. Thank you so much again. Thanks for Evelyn and Jordan and Eric, basically VP Operation. We really appreciate if you guys could take a minute of your time and really write us a review on Facebook or Trustpilot. We really try hard to really take care of our patients. Also, remember, Happy is a customizable formula, so we could change the product just for you. Please let us know if there's any questions or concerns. Please email us at help@happy. Have a happy holiday season.